what I want us to really think about today is not fixing an immediate need. Quite often, that's not the hard part. The hard part is looking ahead into the future and saying, how are these decisions going to impact future decisions? And how are these decisions going to work in years to come? So, think big. The other thing I like to tell people in this process is don't limit yourself by self-imposed regulations. Now, what does that mean? I love sitting down with developers at a table and say, do me a favor. Dream big first. Let's put the code away. Tell me what you want to do. And then let's bring the code back in and see what will work, and maybe some things need to be adjusted. So don't look at it and say, well, we can't put a trail along the rail line because the rail line won't let us. They may not let us today, but maybe in the future they will. Maybe in the future we can look at those kind of options. So today's your day. As my boss is looking at me like, what's he saying? Put away the laws, put away the city code, put away our land use regulations for a moment and dream big, okay? Let's get all the ideas out that we can, and let's go as big as we can, because it's easy to bring things back in. So today, dream big, all right? So the two issues, transportation first. I'm going to bring Javier up, and he's going to lead us through that discussion. Then second, we're going to talk about healthy communities and how to build in healthy environments, okay? Javier.
Thank you, Mark. Good morning, everyone. Very excited to be here. Is everybody excited to be here? Raise your hand, say something. I don't hear anything. All right. I'm not a musician, so I'm going to try to keep you awake as I talk about these exciting things that we're doing in transportation. Like Mark says, you need to keep in mind that this is more a vision. This is the future. We're part of this team that is putting together the update of the comprehensive plan. The transportation element is part of that, so this is what this discussion is about. So here you see it's a full mouth, mouthful of words and sentences, but it sort of encompasses what we're trying to do with transportation. The vision pretty much is to create a multimodal transportation system in the city. To address multimodality is not a simple task. It encompasses working with stakeholders like yourselves, the elected officials. It will also have the other agencies, transportation agencies within the county, the MPO, the DOT. But as you can see from all these bullets there, it starts with encouraging and providing a safe, efficient, and sustainable modes of transportation on our streets. So that, again, it goes back to the issue of walking, bicycling, taking transit, driving, ride-sharing. You almost have to think about transportation. I always tell people that when I try to convey the vision of transportation, it's more about options. So think about the time when you leave your home, you step out the door, and you think, how am I going to get to work? How am I going to get to the grocery store? What's the most convenient way to get there? And the answer for that, the way that you should be able to answer that question is, I can just going to take my bike because I feel safe doing that. Or I could just walk because it's close and convenient. I feel safe walking to the store. Or I can take the bus or the shuttle or the trolley or something like that. So not just thinking that the car is my only option, but thinking about all other options you may have. So there is a lot of elements that come into this vision and goal, and again, it relates to coordination, it relates to working together, and it relates to providing a direction so we can, all head the right direction, I guess, to put it simply. So the next part I want to talk about is the existing conditions. We have pretty much a good, what I call it, a good backbone of transportation currently in the city. We have the tri-rail system running, serving the city. We have the trolley, we have buses. You can walk around the city, most places. We're working on a bike share system. We were given authorization by the commission to proceed with negotiation with a vendor to develop a bike share system in the city. Do you all know what bike share is? Only Mark. You. Okay, 2. Okay. There you go. I'll explain short. It's very much in a sentence. Bike share was created, maybe it came into place about 2008, 2007. It started in France, and then it slowly trickled into this country. The bike share system, what it does is it allows people to use it. It's like a rental. You rent a bike, you go to a kiosk, you insert your credit card, you put your numbers there, you release a bike, you're on your way out. So you can go and try and use a bicycle to go anywhere you want within the city. And then once you get to your destination, you look for another station. That's where you're going to lock in the bike, and then you're on your way to whatever. You can go shopping or the store, or visit a friend, or go to work. So that's the idea of the bike share system. So like I said, we're working on that. Then there is a whole line of elements associated with bicycling, including the bicycle parking, bicycle master plan that we're going to talk about later on. Also, as part of the existing conditions, the MPO, the Metropolitan Plan Organization, has developed a bicycle safety study, and this is some charts that they are part of this study. The study actually came up with some good recommendations and pointing out some deficiencies in the system within the city. That's part of the deficiencies that we have on Atlantic Avenue for bicycling and pedestrian. It points out several intersections around the city where we're going to be focusing on efforts to try to get improvements going on there for bicycles and pedestrians, the mode of transportation. So now we're going to talk about the accident data that we got from the City of Delray Police Department. The data was collected through a number of years, and thankfully they send us this data, which for us is really useful. It goes from 2013 to 2016, 4 years worth of data, and it shows 10 different intersections. As you can see, the top of the chart shows the total crashes in 2016 were about 3,800, significant. And these are all types of crashes, not just pet bikes, but cars. It just involves all the accidents. Some of the intersections there are more critical. I think you probably are more familiar with that than most, even me, because I've been here only 8 months with the city. But Atlantic Avenue and Congress Avenue is at the top of the chart for pretty much consistently since 2013 through 2016. Another way to illustrate that is through this chart that, again, total crashes per year. We went from 2013 from 2,100 or 2,200 almost to almost 2,700 in the year 2016. So slowly increasing. It should be going, our aim through this process is to tackle those and to start heading down, decreasing the rate, exponential rate going up. The fatality chart has increased. From 2013, it shows 7. 2016 is 12. 2014 seems like the city did pretty well compared with the other ones, although ideally we'd like to see 0. There is also a major effort going nationally about Vision Zero, and that, again, was started in Europe. But the ideal Vision Zero that most cities in the country are heading to is to try to create a goal to lower the accident rates to basically 0. It's a long-term goal, but it's something that we should be aspiring to do as well. So we're going to be integrating a little bit of Vision Zero policies into the comprehensive plan to get us there, to lower these accident rates. So we want to show you a little bit of the community survey results. Our planning department gave us this data. So the question was, on the scale from 1 to 10, how bikeable do you feel the Delray Beach is? 1 being the non-bikeable at all, and then 10 is the best, the greatest. So we're about right in the middle. The other question that is there is, on the scale of 1 to 10, how walkable do you feel the city of Delray Beach is? And again, the scale is 1, not walkable at all, and 10 being the best. So we're about 7. It's a little better than bikeable. So from this, you can almost think that people can walk around the city more comfortably and safer than riding the bicycle around. What is this one? So we also wanted to show you these charts, which we believe are very important as we're putting together this comprehensive plan. The question on the left is how important it is to provide areas exclusively for walking, cycling, or alternative modes. It's very important. It's all the way basically to the top, over 60%. Important, it's about 30%, and not important is very low. So we're aiming to put that, emphasis on mobility from the bicycle pedestrian standpoint. On the right side, you see that the other question was, do you feel that there is more need at the following? Sidewalks or dedicated bike lanes? It seems like the dedicated bike lanes, takes the lead on that question. And then I just want to stop here and talk a little bit about bike lanes. There is all kinds of bike lanes. The ones that you see typically is a striped white with a separation between the stripe and the curb. That's a conventional bike lane that we call it. Sometimes we stripe that green. Sometimes it doesn't get a stripe of any color, but just asphalt. There is also the going up in the sort of like chart of improving bicycle facilities. You have the protected bicycle facility. The protected bicycle facility basically offers a protection for the cyclist from the traveling traffic on the typical travel lane. There has been some surveys around the country that shows about 60% of the people that want a bicycle, but don't feel safe. So the idea of the protected bicycle facilities is to emphasize or to address the concerns of the 60% that they don't feel safe, but they want a bicycle. There is some sort of a sense. How many of you bicycle? Just to get a great portion of you. So you know how it goes. When you are on a bicycle lane, you can feel the cars going through. Sometimes the drivers may be distracted. Sometimes they're going to drive really close to you. Sometimes they're going to keep their space. By law, they're supposed to keep 3 feet separation between the bicyclist and the cars they pass it. But some cars don't. So the idea of the separated or the protected bicycle facility is to basically create a safer environment for the bicyclists to get through a bicycle facility. So we're going to talk a little bit more about that, but just want to give you guys a taste of it. So in order to begin to address some of these mobility issues in the city, we have put together here a list of projects, the current projects that we have and the projects that we will be working in the future. So just recently, last November, the Commission approved the Complete Streets policy. That puts us on the map because there is only 2 cities in the county that have Complete Streets policy. Those are West Palm Beach and Delray Beach. And I tell you, it makes such a big difference. We'll go to an MPO meeting, or we'll go to a county meeting, or an FDOT meeting. They always talk about us in a good way. See, there is only 2 cities in the county who have, this policy, and it makes you feel good when you're sitting in those meetings. But what that does is that it forces us to think more in terms of multimodal transportation within the street. In the old days, us engineers used to design the streets as from the center of the right-of-way out. So what that creates is that you allow more room for the cars. So sometimes you see those 12-foot travel lanes. Sometimes you see 14-feet travel lanes. And that creates that huge street, that covers between curb to curb. The complete streets policy takes a look at in a different way. So you go from the right-of-way lines towards the center line. So you start with addressing the pedestrian facilities, you start addressing the bicycle facilities, more of the urban environment you see there with the landscaping. And then, last, as you get closer to the center of the street, then you incorporate the travel lane. So that allows us to get into the 10-foot travel lanes with the 6, 7-foot bike lanes that may be protected bike lanes, not just conventional bike lanes. Allows more room for the pedestrians to get through. There is more landscaping, some shade trees that allows for a more comfortable environment for pedestrians to get through. And also, the city is committed to develop an implementation chart or an implementation handbook that will allow the other departments in the city, such as our construction branch, public works department, to basically look at that development or design of the streets in that fashion. Yes?
Really quickly, how does the complete street concept incorporate alleyways?
The question is, how does the complete streets concept incorporate alleyways? The complete streets policy addresses mostly the street. The alleyways are part of the system, so it all gets integrated. So when you do complete streets, you also look at the alleyways in terms of connectivity. So you address that from that standpoint. So some of the recently completed projects, bicycle projects, I'm sure you have seen these. The 2nd Avenue between Northeast 4th Street and George Bush Boulevard. Beautiful road. How many of you had a chance to ride your bicycles? Thank you. Very nice. Some of the other projects that we have going on, the current studies, multiple studies going on. The ADA is implementation study that is basically we're trying to get a sense citywide where are the gaps to meet ADA standards. I think we have 36 miles of sidewalks to review. We're staying away from the county system and the state system, so this study only addresses the city system. The Congress Avenue study, I can spend the whole day talking about Congress Avenue. It's first of all, there is an MPO grant that the city applied last year. We're still working with the county in order to address the concerns that they have about that concept. The concept that we're trying to implement on Congress Avenue is a complete streets concept, essentially. Congress Avenue, as you know, currently is 6 lanes, 3 lanes on each direction. So we're going to convert that what is called a road diet. So we're going from 6 lanes to 4 lanes. And in addition to that, we're going to take the lane that we're taking out of the 6-lane configuration on each side. We're going to take that and make it a cycle track or a protected bicycle facility. So the design of this protected bicycle facility is what the county is having a little bit of a hard time getting through their process. And I think the most difficult part is addressing drainage. So we're playing around with different concepts to address our concerns. And hopefully we'll have it resolved within the next month or two. The only issue there is if we don't address our concerns in the next month or two, the funding is going to go away. So we need to be on top of it. We're working internally and with the county to address those concerns. The other study is coming up, and we'll have some information here for you to pick up, and we put them over there also in the registration desk. It's the US 1 multi-model study. It's pretty long length of a project. It goes from Camino Real in Boca Raton to Indian Town Road in Jupiter. So obviously it crosses through our town, our city. And the purpose is to develop a comprehensive plan to implement continuous multi-modal facilities. So you're talking bicycle, you're talking pedestrian, you're talking transit, including having a bus rapid transit. The county and the MPO understand that that's the busiest route for transit in the county. So, this study we'll try to incorporate those needs into the plan to address obviously the current needs. And there is going to be a kickoff meeting May 6th in Boca Raton. Again, there is a flyer here available. If you're interested, we can give you one. And then there is also a website. We can give you more information on that. We just kind of put together this list to give you an idea of the multiple MPO, Metropolitan Plan Organization grants that we're working on. Most of these are from the last year. We sort of inherited as we're starting our current jobs. I started last August. Margarita, who is our bicycle pedestrian mobility coordinator, started in October, right? So when you look at all these projects, there is a common theme here. None of these streets currently have adequate bicycle pedestrian facilities. So the idea here is to create that connectivity again around the city, where the system will connect itself, both from the pedestrian standpoint and the bicyclist standpoint. The grants are not for planning purposes; they're more for implementation projects. So we can't just use the grant for a bicycle pedestrian master plan or some other model plan. It has to be for a specific project. So some of these projects are already in the design phase. Some of them are already ready to go to construction. We're at different stages on all these projects. Some of them are administered by FDOT. Most of them are administered by the city. When FDOT administers, that means that they are pretty much an engineer to the city. So we are the project managers, they are the engineer, and they handle all the design, construction, inspection, from everything from the engineering standpoint. Swinton, from Southwest 10th Street to Northeast 4th Street, is one example of that. It's fully administered by FDOT, and FDOT is the Florida Department of Transportation. And then the last one, where they talked about that one, is Congress Avenue from South Atlantic Avenue to the city border with Boca Raton, the canal. 10th Street, Lawson Boulevard, from Military Trail to 6th Avenue.
Federal 6th Avenue?
Yes, that's the one that goes northbound. Some of the upcoming work, the bicycle pedestrian master plan is listed at the top. There have been some work done already. We're going to take whatever we have so far in terms of that plan that we can use as a background and sort of update all the information. We're also going to develop the street design guide as part of the plan. The street design guide, what it is basically an implementing tool of the plan. You're all familiar with plans. You always think the plan is going to be done. Somebody's going to shelve it, and who knows when you're going to look at it. Well, the idea of the street design guide is more of that. Keep the plan alive. Keep the plan in front of designers, engineers, planners. So in that way, we keep it moving and implementing along as we do it, the projects. You also will have a bicycle parking plan. When you look around the city, that was the first thing. I came for an interview with the city, and then I'm a bicyclist, so obviously I look at bicycle facilities. And then I look at the downtown, and I noticed that some of the parking for the bicycles was very sporadic, and it wasn't really addressing much of the needs of people that work in the area. You got to think of, and again, that's where bicycle fits into that transportation modality, or the ability for people to use their modes. Because you work in downtown, say you work in a restaurant, you want to ride your bicycle to work, you want to find a place to work. So you can leave your bicycle there, do your shift, you complete your shift, get your bicycle, you're moving on, you're going back home. But most bicyclists, most people that ride their bicycle like to have their bicycle parked where they can see it. As you know, bicycles get stolen, so having the ability to see the bicycle where you're close to it gives you that sense of comfort. So that's the idea behind this bicycle parking plan that will go together with the land uses adjacent to where the bicycle parking needs to be and provide that comfort and therefore the ability for people to use their bike to get to work. The wayfinding signage plan, we're working with the CRA to develop a wayfinding plan that's going to be very comprehensive. It's going to be a citywide plan, and then it will provide a way for visitors and residents to navigate more intuitively through the city. Some examples of, again, going back to the bicycle pedestrian master plan, what a protected intersection is versus a place where you feel not so comfortable riding through. The one on the right side, the top right side, is a current condition in New York City. It's courtesy of Margarita. She was just there last week. So as she was there, she sent me this picture. I go, whoa, there's an issue here. And the issue here is that your bicycle lane is on the left side. So think about it, by the time you get to the intersection, there is this left turn lane. So when the car is turning left and your bicycle is going through, there's a conflict. It's a major conflict. So you want to design a facility, a bicycle facility, that should not be conflicting with the through movement of the cars. So that's the idea behind this protected intersection. It should be more visible as a cyclist, and also allows the motorists to see the interaction with the pedestrians and bicyclists as they move through an intersection. So there is all these conglomerate things about it, but in some ways, the example that's shown on the left-hand side, bottom side, is from Holland. It's more intuitive. So that's what you want in a bicycle transportation system. When you, as a bicyclist, you don't have to think too hard where you're going. You just kind of, you go with the flow. Everything is pretty well marked to you. And then also the drivers understand that the pedestrian or the bicyclist are going to get through it, so they pay more attention to it. And then our work continues. So as I said, when we started this presentation, we are part of the team of the comprehensive plan update. We're going to be developing or updating this transportation element. There are several policies and goals and objectives within the transportation element that need to be updated. We're also going to be introducing new elements, new language as part of the policies and goals that will take us into the future for transportation. We just kind of put together a list of the several partners that will be working with together for this effort. Some of these partners will work on a daily basis, some of them as often as we need to, but they're all there. We do actually a lot of coordination with the city of Boca Raton. As we move along with roadway improvements, bicycle pedestrian improvements, they're a really good partner for us. So that concludes the presentation, and these are our contact information. I don't know how you want to handle this, Mark. You want to do the Q&A now, or you want to do it at the end, or okay? You are the master of ceremony, so I'll give it back to you.
Unless anyone has any specific questions right now for Javier. I don't see any hands. Okay. Oh, there's one over here.
Got one question.
See how I am?
So, with the built-out, thank you. With the built-out environment, like especially downtown is, how do you go about designing or retrofitting an urban environment to fit some of these? I'm all about protected bike lanes, love it. Without eliminate street parking, which maybe down the road, I don't know. How do you go about retrofitting this? Because you need to obviously own the sidewalks, you need to own the streets, you need to redesign the streets, there's a lot of infrastructure improvements that would need to be made. And do you feel that it is feasible to create this type of environment in Delray?
Very good question. I'll answer in two different ways. One way to answer that is that, first of all, I think that the city needs to have a way to prioritize modes. One of the things that I have seen in other cities where I have worked is that the commission typically prioritizing modes in such a way that allows for this planning to take place. For instance, a typical prioritization of modes of transportation would be at the top of the chart, you see the pedestrians. all of us here are pedestrians at one time. So that's very, pretty much common sense. The number 2 mode typically is a combination of transit and bicyclists. Sometimes the bicyclists go first before the transit, but it's usually about 2 and 3 or 2 together. And the last one is the automobile. What that does is that sort of like instead of having a pyramid where the automobile is at the top, you reverse the pyramid and you put the pedestrians, and then the automobile falls at the bottom. But it has to start from the policy standpoint. I can't just arbitrarily go over there, go to Atlantic Avenue, and then say, oh, by the way, we have this wonderful plan. We're going to put a bicycle facility through here to connect Swinton to 5th or 6th. And we need some space for the bicycle facility. So it has to be in concert with a larger scope of work that will address a need. It may not work. We may have to reroute the bicyclists going, like we do for the automobile. We have the typical detours or bypass. We may have to, there have been some potential discussions about creating more of a pedestrian environment on Atlantic, especially where it belongs to the city, which is Swinton to 5th, where we have currently a 2-lane facility, and it's very narrow, constrained, and you can't drive there fast. You have to drive it slow. So it's an area where it's more presented as a pedestrian environment. So, in Miami Beach, you have, for instance, Lincoln Road Mall. It's a pedestrian mall. And so, everything is about the planning effort. Everything is about where we want to go as a city. So, and then the prioritization of the modes is essential. Without it, and then it also helps you in dealing with budgeting. Most of the time we get into, I'm sure you have gone to commission meetings and staff meetings or committee meetings where people talk about, well, we have $800 million of needs. We only have $200 million in the budget. What's going to give? What's going to be taken out of this? So having this list that will help you to prioritize the projects that will go forward and make it a go. Good. Thank you.
Take a couple more and then we'll keep moving. Mr. Warner.
Thank you, Xavier. Was there attention given to using the median on Congress Avenue to locate a bike lane? And if not, if yes, why doesn't it work? And if not, big chunk of space out there has nothing but nice, beautiful green growing.
Okay, Congress Avenue. Again, going back to the start of why this street is being looked at. It was part of the MPO grant. It was submitted to the state. To the MPO last year. And it was looked at. These applications go through a very extensive review process. So you made it this far, so that means there is merit. The Congress Avenue has a 45-mile-per-hour positive speed limit, most of the section. It makes it very uncomfortable for a bicyclist to ride on a bike lane. These cars are going fast. There's trucks. There's large cars. There's regular cars. But it's the speed that gives you that sense. As a bicyclist, you're not going to be safe there. So the idea of doing this road diet, to take one lane in each direction, and to have a protected bike lane creates that environment where the bicyclists will feel safer riding through that street. Second part to that question is that the city has been through discussions. There is a task force, Congress Avenue, and the direction that has been given us is pretty much they want to make it a complete streets. So going back to the earlier part of the presentation, the complete streets encompassing, all modes. Right now, Congress is not really a multimodal street. It's automobile. It's not much of a pedestrian. You have nice sidewalks. Nobody walks there. There's no shade trees. Again, the speed of the cars is crazy and not much of a destination. So I think that in the future, the city is looking at Congress Avenue more of a extension of the downtown. And we have to create an environment for that starting from the street. So that's the idea behind it. Yes.
I'm sorry. I don't mean to cut anybody. I just have a
question about if we're looking at all of the north-south transportation streets like Congress Avenue, Federal had a road diet. Is there a larger comprehensive plan of the highway transportation system if we're starting to narrow all of these roads that a lot of people use as alternatives to travel from city to city?
Well, there's two pieces to that. One is the city transportation system, which we have control on, and then there is a state transportation, which the state has control on. Like US 1 is DOT. So anything that goes on DOT, they work with us, but they're the lead agency. I think the best way to answer your question is we have to look at the system together. So that's what we're working with these other agencies. As they're doing their planning for the roads, we need to be at the table talking about how that's going to be fitting into the planning of our roads. So it all connects. So we don't want a disjointed system where the state is building this, maybe a protected bicycle facility, and we're not even have bike lanes on our road. So a good example is that, and one of the projects that we're going after the MPO as a grant application this year is Linton between A1A and US 1. Again, I'm a bicyclist, so I usually cycle A1A, north, south, go every direction, depending on the time of the weekend. But when you take A1A as a bicyclist, you want to go west on Linton. You take Linton, there is nothing there for a bicyclist to feel safe about. First of all, as you get closer to the bridge, you got 3 lanes going westbound. The bridge is horrible as a bicyclist because it has its grate, and that we call it a cheese grater. In bicyclists, that's what we call it because you fall into that, your skin is pretty much torn apart from your body. So, and then as you keep going, there is a right turn lane going to US 1, but yet that road connects A1A, which is a bicycle, very, very friendly bicycle area, with the US 1, where we have, again, bike lanes. And so the idea of the project, again, is to create a connectivity both directions. So we're putting an application for a separated bike lane, a protected bike lane on the north side of Linton, the south side, to connect, US 1 to A1A. So that's a good example of where the state has their facilities, the state has planned for that, but unfortunately we need to work. And the Linton is a county road. So, there's the partnership with our players, transportation players.
All right, I want to move on to Lauren Zuckman. She's going to come in and be talking about healthy communities. This is a new element for us, and it's one that's growing in many communities around the state and in many communities around the country. As public health and health-related issues take a bigger spotlight, we realize this is something we don't want to just bury into a few different elements, but call out on its own. So this is a new one for us, again, and we are looking for a lot of input on this, and we are very fortunate and blessed to have Lauren here. Lauren is part of a larger effort to bring health, especially looking at mental health issues, to the forefront. Because as we begin to understand these issues and begin to talk to them as a community, one, it removes some of the shame that clouds these issues, and two, it allows it to then take the center stage as something that we can talk about as a community. So, Lauren.
So good morning, everybody. As Mark said, I'm Lauren Zuckman. I'm with Healthier Delray Beach. In a couple of slides, we're going to talk about Healthier Delray Beach and have a few other initiatives, the Delray Beach Drug Task Force, Parks and Recreation. You're going to hear a little about all the different pieces of health, hopefully, and the great initiatives that are already happening in Delray Beach. But first, we got to start to talk about what does our community look like when we're talking about health. So there's good news. We are, as a county, Palm Beach County is the number 8 in healthiest counties in the state of Florida. So 8 out of 67. So that's pretty good. We should be proud of that. That's moved up since a couple years ago we were 10. So we're moving in the right direction. And within Palm Beach County, Delray Beach is one of the only cities that was named the healthiest weight in Palm Beach County. That's a new initiative by the county to encourage different cities to be healthier. So we got that designation last year this time, and what that says is that we were able to improve rate of obesity by 5%. So decrease it, meaning we improved our health in that respect, and we are one of the only cities to do that. Within the last 3 to 4 years, so starting in 2013 to 2016, we improved by 5%, which is pretty significant. But, of course, there's always a but when we talk about health. We do need to look at what our health looks like. And there is the good, and of course, unfortunately, there are the challenges. When we talk about health, I want to make sure we all are talking about not just physical health, we're talking about mental health, everything that makes a person healthy. And when we talk about healthy people, it then leads us to talk about healthy communities. To think about health, we can't just think about exercising, sleeping well, making sure that we have someone to talk to, or, what do we do when we're having a stressful day? We also need to look at social determinants of health. It's really important when you're talking about the health of a community, you're looking at the things that affect health, not just how we take care of our own personal health. So to say we are a healthy community, we have to look at those underlying issues that lead up to people not being able to even have the means to be healthy. So healthier Delray Beach, or a healthy Delray Beach, when we're looking at it as a whole, the city as a whole, we're talking about 65,000 people. Median income is about $51,000. Something interesting I found was it's $53,000 is what it is considered nationally is needed for a household family of 4 to budget out and be able to afford groceries, rent, bills, all the things that you would need to have a healthy family. So unfortunately, our median income is below that $53,000 that's required for a family of 4 to get by and just get their needs met. 86% of residents at minimum have a high school diploma, so that's pretty good. It's high, so we're doing pretty good as a city. That other 14%, obviously, we have some challenges and we need to help them. 6% unemployment rate, again, lower than the national average, so we're doing pretty good in that place. 39% of residents are uninsured. That's pretty high. If you think about people who need to have access to health care, mental health care, all kinds of care, 39% of people in our community. Oh, sorry, I'm looking at the wrong line. 19% are uninsured. I know as I said it, it sounded kind of crazy. Are uninsured. That's pretty high. And you're going to see in a couple slides later, it gets even higher for specific parts of Delray Beach. When we're looking at poverty, 17, almost 18% of people in Delray Beach are living in poverty. And when you break that down, there's been a 4% increase in poverty in Delray Beach elementary schools. So we are moving in the wrong direction when it comes to what we're talking about our children who are living in poverty in our community throughout all schools, meaning from the east all the way to the west. There's been an increase. 98% of people recently, if any of you were aware of, the county does every couple of years a point-in-time study, which counts city by city how many people are living out on the streets. They're homeless, living in their cars. 98 people this last January, 2017, the last time that point-in-time study was done, they counted within a 24-hour period 98 people living on the streets. And those are just the people that they found and they saw. You know, the point-in-time study is done where they have volunteers that are scouring the streets, literally walking up and down and finding people and asking, do you have somewhere to live? And they counted 98. That went up from 2 years ago. It was 63 in Delray Beach. Now it's 98. That could be because there were more volunteers. It could be they were recognizing more people that were homeless. Or it could be that the problem is getting worse. We're not sure. But something else that's very significant, if you look at how many students in Delray Beach are considered homeless, that's just Delray Beach. It's a very big number. Yeah, it's a big number. 193 of our students are living not in homes, in cars. We do have students living in cars right now with their families. We have students that are what we call couch surfing, moving from couch to couch, whether it's family members, friends, because they don't have their own residence, that is considered a piece of homelessness because they don't have somewhere to call their own home. 65% as we move into actual what we think of when we think of health, which is physical health, even though as a city we are doing much better. Like we said, we are one of the healthiest weight cities in Palm Beach County. We still have about, on average, 65% of adults at an unhealthy weight. So that means about 3-4 years ago we were at 70% because we've been doing better. And 1 out of 3 children are considered overweight or obese. It's a lot of kids. When you talk about actual illnesses, diabetes, 8.7% of adults are diagnosed with diabetes. I could not find heart disease and some of those other chronic illnesses, but as we know, those issues are here. 22.9% of births didn't receive adequate prenatal care. So what we're talking about is those moms. Almost a fourth of moms did not receive adequate prenatal care here in Delray Beach. A fourth of moms, so almost 1 out of every 4 moms did not get the prenatal care they needed. When you move on and you're talking about substance abuse, which I think we all know here in Delray Beach being the capital of treatment centers and sober homes, I saw, and I didn't put it up here because I can't quote for sure, but the last conversation I had, there was something like 600 to 700 different treatment locations. I don't know if I want to say them centers, but locations here in Delray Beach. That's what makes us the capital in the U.S. Some are great. Some are not regulated. Some are here to make some money, and so I don't want to not say there isn't some amazing treatment happening here in Delray Beach, and you're going to hear Mike Hendren talk about the Delray Beach Drug Task Force and all the initiatives they're a part of. But there's also, you know, people see dollar signs when they see drug treatment, and so there are people coming here from other states, not necessarily Delray Beach people, but people coming from other states knowing that Delray Beach is a beautiful place, it's a great place to visit, they can set up a home here and have, you know, people sent by their families down here to get drug treatment. And what we know is some of those centers are unfortunately not providing the best care or any care for that matter. So 60 overdoses, though, when we talk about the substance abuse issues happening here in Delray Beach, just in March, just this last March alone, 60 overdoses. That's 2 a day almost. I mean, that's amazing. And that is, Mike, would you say that's a high month or that's pretty average month as far as overdoses? That's an average month. So we're looking at that being around what it is every month for the last, you know, long while. And then suicide death rates. That is not specific necessarily to Delray Beach. That is the county, but Delray Beach plays somewhere very, you know, close in there. Suicide is the 9th leading cause of death in Florida. And the death rate is about 25 people for every 100,000. So that very much affects what's happening in Delray Beach, too. I think all of the cities are pretty close to that average across Palm Beach County. So it's sobering news. There's some great, there's some, you know, concerning. It obviously makes us want to and hopefully need to look at how we improve the health in our community. Something that I think is even more important to note is when we start to talk about, and if those of you haven't heard about these communities yet, hopefully now is your chance to learn a little bit. When we talk about health in our community, we would be remiss not to talk about a certain section of Delray Beach. That is where our first settlers were. It's where a lot of the history of Delray Beach has come out of. It's where generations of families have been born here, raising families, living, growing. Recently, it was branded the Set. That map, I'll explain, is a little bit larger than the actual Set and the boundaries of it. But the Set is basically the northwest-southwest neighborhoods within Delray Beach on, of course, the northwest-southwest sides of Atlantic Boulevard Avenue. Sorry, I'm thinking the wrong county. So This is important because even though it's where a lot of the history of Delray Beach lives and grows and is, it's also where the most underserved part of our population is. It's where the least amount of services can be found. It's where there's a lot of concerns for health because there's not as much ability and access to services and healthy opportunities for the very reason of the makeup of, unfortunately, those communities. As I mentioned, that map is a little stretched out. So the set is a little bit smaller. It's really east of 95. But the reason why that map is extended is because as we have more schools opening, and there are magnet programs here in Delray Beach, and a lot of great things happening in schools headed a little west, like here we are at Atlantic High School, down the road is Carver, Orchard View is a little farther west even then. We have a lot of our families who are sending their kids, and there are students at those schools, and so through Healthier Delray Beach, we have in our approach and our target population extended that map a little bit so we can make sure we're continuing to serve all of the underserved parts of our community. So remembering what we said about the health of the overall city of Delray Beach, this is statistics just for that map that we just saw. And so when we're talking about the set, we are talking about 12,000 residents, primarily African American and Haitian. This part of the community is considered, if you know about Alice, asset limited, income constrained, yet they are employed. So we're not talking about families who are not working and not taking care of their kids. We're talking about families that are working 2, 3, 4 jobs to make ends meet. But they still have a lot of challenges. 74% of the residents have a high school diploma. Again, that's a pretty high average. We're doing pretty good in that area. Yet 12% of residents are unemployed, and 55% of residents are working in the lowest wage jobs, so service jobs. They are selling food behind counters. They are doing sales jobs like over the phone. So a lot of them are making minimum wage or barely minimum wage. 68% of households in that little mapped area live below the 200% federal poverty level, and that's 78% of the children there. So what we know is out of that 12,000 residents, there are about 3,000 kids, so under the age of 18. 78% of them are living 200% below the poverty level. 57% of residents in this area are living in substandard housing, and that is based off of national definitions of substandard housing. 33% of households receive food from the SNAP program, so supplemental nutrition assistance programs. 30% of residents are isolated by language. So we know there's a very large Haitian community here in Delray Beach, which is a wonderful thing. A lot of the students speak 2 languages, and that's amazing. Yet a lot of their parents and grandparents cannot speak enough English, and it causes them to be very isolated, not to be able to reach out for services and help because they can't speak the language that most of us here in Delray Beach speak. And that leads to a lot more health challenges. If they don't know how to ask for help, they can't speak the language to ask, they are probably less likely to go ask for help. 38% of residents are uninsured. That was the one that I was thinking of before. And 45% of Medicaid. And if you know about Medicaid, obviously Medicaid is for low-income families. So that tells you, that's almost, if you put those 2 together, you almost have 100% of residents that are either low income on Medicaid or not carrying any insurance at all. Says a lot about the health of that part of the community. 30% of Medicare recipients are diagnosed with diabetes. And what's interesting, it's very hard to find, and especially in Delray Beach, there's not a lot of data around behavioral health. How many people are diagnosed with certain disorders? How many people are, as we talked about before, unfortunately committing suicide or needing help? That kind of data in a lot of communities does not exist. But Medicare has been keeping statistics around depression. And 19% are diagnosed, those recipients on Medicare are diagnosed with depression. 19% is pretty high. If you don't know a lot about behavioral health, 19% is very high. To have 90% of the community, or at least of those Medicare recipients, saying that they are having feelings of depression to the point where they have to be diagnosed. I think we all have days where we're feeling depressed, but to actually get diagnosed with depression, there are a lot of factors, a lot of criteria that have to be met. And then 34% of involuntary hospitalizations, and this dates back to last year, in Delray Beach originated from those two zip codes, 33444 and parts of 33445. 34% just from that little tiny, almost rectangle. So almost, close to half are coming just from that area of involuntary hospitalizations, which means they were having some sort of mental health issue that they were required to be involuntarily put into the hospital for that. So not necessarily medical issues, mental health issues. Baker Acts, if you know that term, it's the same thing as involuntary hospitalizations. Okay, so I know that seems really bleak, but there is good news. There are some real, and everyone's like, oh my God, this is a Saturday, give it a break. I know, I'm sorry. So the good news is there are a lot of really great things happening and a lot of active community members and people who want to turn these statistics around. And they're not just talking about how do we Band-Aid the problem, they're talking about how do we get to the problem, how do we get the residents to do for themselves more so to give them what they need to be able to care for themselves. And that is a really important piece to Healthier Delray Beaches. We don't want to come in from other communities and fix Delray Beach. We want to give Delray Beach residents what they're asking for, what they need so they can do for themselves. For Delray Beach, by Delray Beach. We say that a lot. So Healthier Delray Beach is a community initiative focused on improving the behavioral health of the community overall, but very much focused on that rectangle, those families that are most underserved, because we know to have a healthy community, you have to look at the most underserved, sometimes first, to be quite honest. So our mission is to serve as a trusted advocate for the behavioral health needs of the Delray Beach community by creating awareness, encouraging acceptance, and creating access to care. That's a really important thing. I often talk about when I'm talking about those northwest, southwest neighborhoods that it's almost a behavioral health desert. We talk about food deserts there. There's not grocery stores, which says a lot about the health of that part of the community. There's no grocery store. In that rectangle, you can't get groceries. You have to drive out of it. For some of us, that seems like no big deal, but for families that don't have transportation, who are working many jobs, who need to run to get food, they are tending to go to corner stores. And most of us who know have gone to corner stores. You're not talking about great produce that you can get there and foods that aren't, low sodium and all of those things. They're pulling what they can because they are running very quickly and there's no grocery stores there for them to run to. Same with behavioral health services, same with healthcare services. Within that rectangle, there are no healthcare services outside of private doctors, which if you don't have medical care, you can't afford. So there is no health center there. The closest health center is, just so you know, is the C.L. Brombach Clinic, which is on Congress Avenue. That is really the only healthcare center here in Delray Beach that is open to the community and will take all kinds of insurances, will take the uninsured. They couldn't be here this morning, but they did want me to share that on average they have about 1,400 visits a month. So let's go back to thinking about, we have 64,000 people in Delray Beach. We have 12,000 people living in that area, northwest, southwest neighborhoods, who most likely would need those services because they don't have to pay for them. Only 1,400 people a month are going to that health care clinic. So where is everybody else going? And what we know is a lot of people aren't going anywhere at all. They're not taking care of their health issues. They're not seeking medical care. So Healthier Delray Beach wants to really look at changing that. Some of the initiatives we're doing right now, and I'm not going to go through all of them, but we're trying to have a lot of resident health care conversations with the partnership of WARC, the West Atlantic Redevelopment, and the CRA and some of the great residents here in Delray Beach. We're getting people to talk about their health. What is really needed? What would they really be willing to do to get health care? Because it's not about us just throwing services at the residents. It's about residents saying, this is what I need, and us bringing it to them. That's how we're really going to get the right services here. So we're having conversations. We are building the Delray Beach Collaborative, the beginning of a healthcare system within the neighborhoods that's really meant to serve all of Delray Beach, but again, starting with the most underserved parts of the population. And what the Delray Beach Collaborative is a alliance of behavioral health providers. And I shouldn't even just say behavioral health, because Florida Atlantic University is a part of it, providing nursing. And it's the beginning. It's a very small beginning, but it's the beginning of organizations like the Achievement Centers for Children and Families, which serves upwards of 700 to 800 of our kids right here in Delray Beach, to get them services on site at the Achievement Centers, which is, again, within those neighborhoods and right close to downtown, like a couple streets over. So it's the Achievement Centers. It's Families First. It is FAU, it's the Center for Child Counseling, and their focus is trauma work. But it's all these behavioral health providers and other providers, child care and medical care, coming together and saying, we are going to co-locate. We are going to share some of the costs so we can get the services to the residents right in their backyard. And we're going to truly look at what are the barriers to getting services and how do we remove those barriers so everyone can access the services they need. So that is the beginning of that building. We're doing a lot of training. So if you have heard of mental health first aid, how many people have heard about mental health first aid? Few of you. So mental health first aid is actually an international model of learning the basics of what mental health is, and 5 easy steps of how to help someone that might seem like they're in crisis. So that idea of first aid, there's CPR for medical. Mental health first aid is for mental health. So it's teaching the citizens of Delray Beach and beyond. This actually started in Australia. But it's teaching any person who's not in the mental health field what to do until a mental health professional can come in and help your friend, your family, your neighbor, your coworker who's going through a mental health crisis. And those mental health first aid trainings are happening all the time. In fact, starting Monday, for 8 days in a row almost, the Delray Beach Police Department, every single officer will be going through that training so that they can talk about mental health. They're seeing it every day. Our best health care right now is the police department and fire rescue going out and dealing with behavioral health calls. I didn't actually put that in there, but in talking to the police department and Delray Fire Rescue, they have said that fire rescue, definitely around 75% of their calls, and don't quite quote me because they weren't exactly sure on the percentage, but about 75% of calls they get are mental health, behavioral health calls, substance abuse, overdoses, those kinds of things. That's high. They're dealing with more mental health stuff than they are fighting fires or dealing with medical issues. And so we need to support the work they do. I know Mike, again, he'll talk about the First Responders Program that the Delray Beach Drug Task Force is doing to support the professionals that are providing the care until we can get more mental health professional services here. Trauma-informed care training. There is a large amount of trauma that our children in our community are experiencing. A national average, which is also a local average, is about 26% of our children, so almost 1 in 4, a little more than 1 in 4, experience trauma before age 4. And in our community, having worked in these schools, I know that to be true. There's a lot of trauma. So I've been told to define trauma. Trauma means it could be a plethora of things, and it's really a lot of the time your reaction to going through trauma. It could be childhood abuse or neglect. It could be being in a car accident. It could be witnessing someone getting shot. It could be grief and loss over the death in the family, any kind of sexual assault or physical assault. It honestly could be watching the news. And some people who don't have the same, we call them resiliency factors, they don't have the kind of support they need to be able to watch something on the news and then walk away and say, wow, I'm okay. I can at least get through the rest of my day. Some people do have trauma after watching a lot of what's happening in our community on the news. And so even that in itself can be traumatic. And so suicide, there's so many different kinds of trauma that unfortunately our kids are experiencing. Divorce, domestic violence, I could go on and on and on, but these are the things that our children are experiencing and taking into adulthood. And often, because we know they're not seeing mental health or possibly physical health providers, doctors, as we saw those statistics before, they are not getting the help, and so later in life it could manifest into other behaviors. Equity workshops. I think that's one of the things we're really, really proud of right now is we're doing a lot of work around equitable practice. And what I mean by that is we're talking about those uncomfortable things right now. Why is it that those African American Haitian families are not getting the medical care as much as the rest of our community? It's an uncomfortable thing to talk about, but it's a necessary thing to talk about if we want to be a healthy community. So we are trying, just our little pieces, we are trying to have those conversations. We're bringing in national trainers to talk about equity because we don't have all the answers. They don't have all the answers, but they've been doing it a lot longer than us, so they're coming in and helping to foster conversation. And from there, hopefully, we are starting to make some new decisions about how to tackle some of these health issues. So we're having racial equity workshops. We're doing poverty simulations. We're encouraging people to experience a little bit. You can't quite experience it, but at least spend a few hours talking about it. What does it feel like to live in poverty? And you are all, as community members, invited to be a part of these things. I skipped over the first one, which is Build Our Blocks. That's a really exciting new initiative that we're doing, which is going into neighborhoods and saying to neighbors, we want you to reconnect with your neighbors. We want you to know who lives in your neighborhoods. We want you to work on something together. And so part of what we're doing is we have ambassadors, which are Delray Beach residents, who are helping us to reach further and further into the community. And these ambassadors, one of them is sitting in here right now, Joanna Reed, who's helping lead that, going into the neighborhoods, knocking on doors, saying, we want to help you not only take care of your mental health, but your physical health, all of your health, because a community that's connected is a healthier community. That's just common knowledge. And we are asking them to pick projects they want to work on. It could be beautifying their street. It could be having a cook-off, so there's a chance to have a little healthy competition, but do something fun together. It could be maybe doing some sort of charitable project together where they're giving to another neighborhood or giving to a larger organization. They get to pick the projects. Healthier Delray Beach is kind of there behind them, encouraging them, giving a tiny bit of money so that that doesn't stand in the way of them spending time together and doing things together. And we're hoping that that will help to build our blocks, literally. And connect the neighborhoods together and connect our neighborhoods. And we really believe that that will make us overall a healthier community. Teen Life and HDB, I'm sorry I'm skipping around a little bit, but I think it's really important, was born right here in this school. I brought a speaker with me more than a year ago to talk about mental health. And after that speaker was done, 6 students came up to me here at Atlantic High School, a couple of sophomores, one junior, and said, we need to do something. And I said, I'm so happy you asked because I've been waiting to figure out how to get youth involved in Healthier Delray Beach. And so they birthed Teen Life and HDB. They named it, they created the logo, they had a whole PowerPoint about what Teen Life and HDB was going to do. And since last year, it has turned into a group that started here, that's had up to 50 students at any given time getting together to talk about mental health, doing different kinds of workshops. They did monthly workshops this year at this school about all different topics with speakers. They had a chef come here and do healthy cooking. They did meditation. They had someone come in to talk about suicide and depression. I'm just going to talk loud. It's working. It is. It's going on and off. Okay. I have to move my hand. It's like a wind watch. And this year, because it was going so well, it moved to Carver Middle School, and now it's at Village Academy also. So they are monthly also doing activities. And the intention is that eventually all the schools will connect, and it won't be a school club, it'll be a youth movement here in Delray Beach. And the idea behind it is youth need to teach youth. I can stand in a room and everyone's going to drown me out because I'm some adult talking about behavioral health. It is so much more powerful for youth to learn about mental health and then teach other youth and encourage them to take care of their health. And we're not just talking about mental health, we're talking about physical health, we're talking about healthy communities. And so we have almost about 75 to 100 students that are participating across the schools. And their first big event, which was last year here, 500 students participated. So it's getting there. It's doing pretty good. And one of the other things that they did, which we're really excited about, is they said, well, we need to have a day or something going on that we can show our support. We can show how far our reach is happening. And I said, well, May is Mental Health Awareness Month, so we should probably do something in May. And it's right before school gets out, so it's good timing to have a big shebang at the end of the year. So last year, we decided we were going to pick a day and we were going to wear green. And you can see these flyers on the tables. We picked May 25th, and we encouraged all the schools to wear green, and there were some businesses here in Delray Beach, and we made a presentation at the city where we proclaimed Mental Health Awareness Month in May, and we had an event here. That's where the 500 students were. And we're pretty proud of ourselves. Well, this year, a countywide initiative, if any of you have heard of it, the Birth to 22 initiative, United for Brighter Futures, which is a youth master plan looking at services for youth, and all the child-serving organizations are a part of it. They decided they wanted to take it and help us take it countywide. So this year, on May 25th, it's going to be bigger, better, brighter than it has been the year before. And the Palm Beach County Sheriff's Office is participating. They already wear green, so it's not that hard. But we're going to give them stickers that say why they're wearing green for that particular day. And we have all the schools. The school district put out a bulletin about 2 weeks ago encouraging all the schools to get their students to wear green on May 25th. And maybe even do some activities around mental health, whether it's like 5 minutes of meditation, or we put out lists of books that are focused on mental health, topics. They could read those in their classrooms. Old School Square is going to be lit up green, so if you're wondering why on May 25th it's green outside, because they are supporting our mental health here in Delray Beach. There are businesses like Mellow Mushroom last year. If you walked in and was wearing green, they give you free appetizers. I believe they're doing that again this year. We're going to have green smoothies and all kinds of things, whatever anyone wants to do. It's just that idea of it's okay to talk about mental health. And if we talk about it, then maybe it'll encourage us to ask for help. And that will lead to a healthier Delray Beach. So please participate in it any way you want to. My information's on there. We even have our own web page now, all kinds of templates and things on it that you can get involved. And I am happy to help you to be a part of that initiative. And then the very last one that I do want to bring attention to is Healthier Delray Beach absolutely isn't the only part of the community talking about the need for a healthcare center. The Village Center project is something that came out of, I don't honestly even know where it started, Southwest neighborhood. So that's, not a hard guess. So it came out of people saying, yeah, we don't have a healthcare center. We have some education centers, but wouldn't it be great if we had it all in one place? And so this idea of Village Center project came about. And now there are part of the city and the CRA and work and the school district talking about what if we built pie in the sky, this 3-story beautiful building that had mental health and medical services, that had adult education, that had career source type projects going on in there, and everybody could go to one place and get all their needs met. Wouldn't that be amazing? if it sounds crazy, do know that there are other parts in the county that have that. In Jupiter, there's something called My Clinic, and they are they are quickly growing these services to where they have behavioral health and medical, and it's all for uninsured, not great insurance, where you can't afford your copays, you can go there. And so it's happening in other communities, and if they can do it, we can do it better. So we are starting to slowly work on that. That is going to be a long project, but we are always looking for partners for that. And mind you, when I say we, I'm not talking about Healthier Delray Beach. I'm talking about Delray Beach is working on the Village Center. So with that said, I am now going to ask Mike Hendren to come up here and talk about the Delray Beach Drug Task Force and all the great things that they have been doing.
Good morning. My name is Mike Hendren, and I'm the Executive Director currently for the Delray Beach Drug Task Force. We are an organization that has been around since the early 90s. Started off with a group of 5 people sitting around a table, which has now grown to well over 70. Our mission and our goal has been and continues to be to provide leadership and education as it relates to the issues that have come about from substance use disorders. We have a couple of different initiatives that I'm going to speak to here, and then I'll tell you a little bit more about, again, some of the concerns that the community has had, specifically around sober homes and the treatment industry. I would like to reframe and clarify some of the things that were said by Lauren with regards to treatment. So, in fact, there are a little over 200 licenses that are pulled here in Delray for people to administer treatment, meaning treatment on a couple of different levels, coming from detox to residential levels of care, partial hospitalization, and intensive outpatient. So again, a little bit over 200. Delray is not necessarily the recovery capital or treatment of the world. It is a large recovery community here in Delray for sure. And that is, again, people and residents here that have found themselves in recovery that are now active participants in the community and contributing members of the community, have families here, and have found their lives again being here in Delray. There are also a large number, and it's hard to give you an exact number with regards to sober homes, but again, this was a very important issue, even more so than taxes, with regards to some of the stuff that was on the docket with the City Commission. So I know that there might be some questions around that as well, and I'll speak some to the Sober Home Task Force, as you see up here as well, about what they're doing to resolve some of the issues that have come up. Okay? So Project Trailblazer was an initiative that was started with the hopes of creating a platform and bridging the gap for a large workforce of individuals made up of people coming out of these levels of treatment of care that I just mentioned that were looking to then participate and become, again, working members here in the community. There were issues as it relates to people coming in and being able to, one, discuss lapses in their resumes, how to talk about the fact that they were in recovery or what that looked like, if they were needing to participate or be a part of ongoing treatment while working as well. So we created this platform, which was run out of the Posner Center, which is attached to Wayside House that is in Delray. And again, that was an opportunity for individuals looking to find treatment, to work with businesses here locally that have come on board with this project to help facilitate some of them, again, finding jobs. The Heroin Task Force, or after Narcan, if you don't know, Narcan is the drug that is administered to individuals who have overdosed from an opiate, and I'm sure most of you are aware of the opioid epidemic that is occurring both here but also nationally. So this is not something that is just specific to Delray, nor is it a problem that is just in our community. The After Narcan initiative was created because we were having individuals who were overdosing, having first responders come and administer Narcan. These people would end up at Delray Medical. Oftentimes they would be stabilized and then they would be discharged back in the community. The problem oftentimes was that they would then find themselves right back in the hospital, be it that same day or the day after. So we started an initiative that would address that and allow for clinical intervention to take place on these individuals to help them find treatment, to alert their families to the situations oftentimes they were not aware that was even going on. It actually has grown so much now that we are in the process, and the police force is bringing on a clinician to help address this. And this is something that is not, again, just specific to us, although it is in our area something that is new for any of the police forces and our neighbors here in South Florida, but something that Massachusetts has also implemented, and I would say is a little bit ahead of what we're doing. But again, with a clinical individual on board, it's going to help support the police department, who again is carrying a lot of the burden along with the fire department. The First Responders Program, which we're really excited about, and it says a lot to both the fire department and the police department for their willingness to participate in this. But what we did was we noticed, and again, it would have been enough for both of these departments to just deal with the issues that come naturally from, the community itself. And then we threw on top of, and you saw some of the statistics around overdoses that were occurring, that they are now having to deal with a lot more than most, right? So they are having to deal with a lot of these individuals. They're being exposed to some trauma as it relates to the situations that come up for them. And we brought on a clinician who worked with, specifically in trauma, with individuals with PTSD, and have been doing some trainings around how to cope with grounding techniques, on how to deal with, how to separate what's going on at work with what's going on at home. And we've had a lot of success. And we're really excited about this because as we have taken the data and what we're seeing that's actually happening, this is going to be something that we can share with other communities, our neighbors around us, to allow for support for our first responders and our police department. The SUD Talks, which is Substance Use Disorders Talks, was a platform much like a TED Talks. We've had 2 so far. Our last one was just this last March. And it was a platform that was created to allow for speakers that came in nationally from all over to speak about the issues that were occurring in communities, again, both locally here, but also nationally, what was going on with that, how people were dealing with that, and how they could support or have a platform to speak about that. We'll have another one of those as well. You can go to our website to check out. If you'd like to attend next year, you're more than welcome to come and check that out. Lastly, the Sober Home Task Force, again, something that many of you have seen and heard of. It's on the news. There's been well over 20 arrests thus far. The state attorney, David Ehrenberg, is heading this up. We have 2 assistants that sit on our board at the task force that are advising as to what's going on, but they are in charge of and working with local officials. In fact, one of our own police department investigators has kind of become a rock star with regards to the efforts that she's put forth in leading these investigations. So something we've been really proud of. They are continuing theirs. There will be more arrests this year, all with the idea of, again, cleaning up some of the industry, some of the things that you have heard about, the regulations that are in place, bills that are being set up in Tallahassee to help regulate an industry that needs some regulation. Past that, the exciting thing, again, for us as a task force, both in the fact that we are made up of individuals from all different walks of life, people from the treatment world, the fire department, the police department, business owners, is that we are all in a volunteer aspect, that we are there because we care, because we want to address the issues, and we're having an opportunity to kind of be a leader, if you will, in the forefront here in South Florida with issues and ways in which we can address the problems that we're seeing. All right? That's it. Thanks.
Okay, so we were supposed to have someone here from Parks and Rec, and because everybody deals with health issues, he couldn't be here today because his daughter is sick. So he's home taking care of her. So I will do my best to just talk about some of the stuff he sent to me to talk about our Parks and Rec department here. I'm going to wrap it up really quick. So if you haven't heard of the Let's Move campaign, Delray Beach is leading in the efforts in Let's Move. It was something begun by Michelle Obama, actually, around physical activity and getting out and taking care of your health. And Delray Beach has been a big proponent of this campaign. This year, just in March, Delray Beach logged 2 million minutes of physical activity. And 1 for the county, which is pretty exciting. We had the most physical activity, per se, in Palm Beach County. And so we're pretty proud of that. Of course, there are 8 wonderful parks here in Delray Beach. If you have not been to the parks, it is one of the true assets of our community here. Is there's these beautiful parks with all of these open play programs, leagues. There's this amazing, sports programming that's happening. A lot of general exercise and sports parks and parks with equipment and all of that. We have beaches. I mean, we're living in a beautiful city. There's a lot of opportunity for free or very low cost physical activity programming. So our parks are very much a part of that. And of course, their mission is to enrich the quality of life for the people of Delray Beach by promoting significant recreational opportunities in wonderful park environments. And if you had been to the first workshop, they went in detail about their parks, so we didn't feel the need to do that again today.
So, given all that you've heard, I'm going to two-fist it here. Given all that you've heard and what you're here to do, you're here to think about the comprehensive plan. So how do we take all the statistics and all the programs we heard about, and how do we organize that into a vision for the future? So we can start by creating goals. Those are part of the objectives of today. We want you to start giving us ideas about goals. I started to frame some of these. We want to provide residents access to both effective interventions and treatments. So that, I can't handle both things. Can you hear me without this? Okay. The second thing is the city doesn't provide these services directly. We have to work with partners because the city doesn't have a health clinic, so we have to reach out to nonprofits, the schools, and other organizations. We also want to ensure that people know where to go. So that's an education piece. And finally, we want to develop metrics because we can't do this stuff and not know whether we're making any progress. And often we start that with a health impact assessment, which is one of the frameworks that we use to do planning for health. We also have to organize this stuff. Different people need different things. So one framework which you might consider, you can choose to adopt this or not, is look at it by age. There's youth, they have certain needs, like the teen program that Lauren was talking about, addressing issues of alcohol prevention among kids or behavioral issues that we want to modify young. Adults, middle-aged people have different concerns, obesity, activity, loneliness, depression, nutrition. And our seniors, which are in a very large part of this community, they have different needs altogether. And when you think about the different cohorts, you also have to think about them through different gender expressions. There are people that experience each of these things depending on how they identify through gender. 2 examples, like how do we do this? How do we break all this stuff down? So I took 2 examples. Let's look at nutrition and let's look at the exercise issue. In addition to that, we could also look at the mental health issue. We could look at morbidity, which is a key part of the health issue. But we would set up some objectives, like perhaps this is one of them, or there are others. We want your expertise to define those. So let's say we were to say, the goal is for our community to really understand the healthy plate and how to create one and how to eat that way. Or the 2020 goal of healthy people is 150 minutes of exercise. That could be a specific goal toward health. So how do we get to those kind of objectives, and how do we plan for that in a comprehensive plan? So I'm going to try to help you organize what you're going to think about when you do the workshop part. There's the issue of access. In terms of nutrition, what are the ways in which we integrate health issues of nutrition throughout the comprehensive plan? And they're organized and framed in the health chapter, but they feed other chapters. So do we have access to quality produce? How? Do we have in our zoning appropriate zoning for grocery stores? Do we have in our social services access to food pantries? Do we have community gardens? It's a project I've been working on as a way to connect people to the ground, to vegetables, to earth, to growing things. Also as a food supplement. Do we work with economic development to bring more local markets like green markets? Where do we put them? Should they only be downtown? Should they be somewhere else? Should we look at them out west? In terms of education, we really need to bring that education about health at all levels. Whether we bring it through weight management, working with private organizations, whether we work with the school district, and finally, the partnerships. What can the city do to organize all the different partners that play a role in creating this? So we have, nonprofits in our community. We also have the faith community. How does the comprehensive plan, what is the role of the city in organizing these pieces and giving them a framework and a structure in terms of policy to work together? In terms of the healthy exercises, okay, again, I look at it as access. Do we have, as Javier started the morning, sufficient bike paths, walking paths? Are they accessible to all parts of our community? Are there areas that are underserved? Should they be connected? Should they be, citywide? Should they connect to Boynton? These are the things we have to think about when we set out our objectives. Education. We want to bring healthy communities and more activity. We have to teach people where to go and how to get there. So it's not just, what can the Parks and Recreations Department do? They do a lot. But how can we work through parks to bring in other partners? We have gyms in our community. We have physical therapists. We have recreational leagues. How do all of these pieces come together? And what is the role of the city in supporting each of these aspects? And finally, the partnerships. So with that, I think I leave you with something to think about and a way to perhaps start organizing your goals and getting to the workshop part of today's event. Thank you.
All right, thank you to all our speakers. Here's the thing that we wrestle with. We in the planning world, we can sit around and we can talk about this stuff like for hours. It gets sick. There's so much information we want to get across. So thank you for taking time to listen to all this.